Assalamu alaikum. I am Shanza Shehzadi from MS Chemistry Batch 1. Today the topic I am discussing in my presentation is the medicine of heart and kidney. In my previous presentation I am just giving the introduction of heart and kidney, but in this presentation I am giving the information about the medicine of heart and kidney. In my first slide, I mentioned two medicine of heart, ACE inhibitor and beta blockers. There are many types of medicine that treat the heart diseases, but I'm discussing these two type, ACE inhibitors and beta blockers. The first is the ACE inhibitors. ACE inhibitors are the angiotensin converting enzyme inhibitor. ACE stand for angiotensin converting enzyme inhibitor. Heart medicines that widen your blood vessels, lower blood pressure, and improve blood flow. This helps decrease the amount of work the heart has to do. They also help block a substance in the blood called angiotensin that is made as a result of heart failure. Angiotensin is one of the most powerful blood vessel nerve in the body. Here are some examples of the ACE inhibitors are benzopril, captopril, fascinopril, lisinopril, and quinopril. Pril is the suffix that is used in the AC inhibitor name.
Certain physiological hormones are used by the body to increase blood pressure. These hormones must undergo several reactions before they reach their final state. Angiotensin II is one of these hormones. This is angiotensin I. This is angiotensin converting enzyme, or ACE for short. ACE converts angiotensin I to its more potent form, angiotensin II. This is the angiotensin receptor. Angiotensin II will bind to the angiotensin receptor and cause vasoconstriction. Let's see what that looks like. The blood vessels are tightening here. Watch how the blood vessels go from a wider, more open state to a tighter, more closed state. The tightening of the blood vessels is called vasoconstriction. The tightening of these vessels make it more difficult for blood to pass through them and causes more pressure on the blood vessels. So tighter blood vessels equals higher blood pressure. Since angiotensin II directly causes the blood vessels to tighten, we can use angiotensin converting enzyme inhibitors, or ACE inhibitors, to stop the formation of angiotensin II. Here's how it works. ACE inhibitors bind to ACE and stop its ability to convert angiotensin I to angiotensin II. Angiotensin I doesn't bind as well to the angiotensin receptor, and that causes the blood vessels to open. This is called vasodilation. This is how ACE inhibitors decrease blood pressure.
In my next slide, Remipase. Remipase is the brand name of ACE inhibitors that contain ramipril. Pril is the suffix of the ACE inhibitors. Ramipril, an orally active inhibitor of angiotensin converting enzyme employed in the treatment of hypertension and some other cardiovascular disorder. And its molecular formula is C23H32N2NO5. Here is the structure of Remipase. In the next slide, mechanism of action of ramipril. Mechanism of action of ramipril and its active metabolites. Rami inhibit ACE, angiotensin converting enzyme. Means their active metabolite ramiprilate inhibit the ACE. Angiotensin converting enzyme is peptidyl dipeptidase that catalyze the conversion of angiotensin 1 to the potent vasoconstrictor substance angiotensin 2. Angiotensin 2 also stimulates aldosterone secretion by the adrenal cortex. Inhibition of AC result in plasma angiotensin, which lead to decreased and to decrease aldosterone secretion, result in decreased water retention. Reduce vasoconstriction and decrease water retention contribute towards the antihypertensive effect of ramipril. Ramipril has an antihypertensive effect. The decrease in aldosterone secretion due to ramipril may also result in a small increase of serum potassium. The effect of ramipril on result at the least in part from inhibition of both tissue and circulating ACE activity, thereby reducing angiotensin 2 formation in plasma. It reduces the it reduces the activities of ACE in the tissue and plasma. Beta blockers. Beta blocker drugs that reduce blood pressure by blocking adrenaline, which help your heart beat more slowly and with less force, which lower blood pressure. Beta blockers also help widen veins and arteries to improve blood flow. Here are some examples of beta blockers: atenolol, metoprolol, and betaxolol. In my next slide,
The heart is beating too fast. This is the beta 1 receptor. This is norepinephrine and epinephrine. They are also known as adrenaline. This is calcium. These are calcium channels. Both norepinephrine and epinephrine bind to the beta 1 receptors. When norepinephrine and epinephrine bind, they provide the energy needed to open the calcium channels in the heart. Let's see what happens when too many calcium channels are opened. Calcium can enter into the tissue of the heart. The ionic charge of calcium initiates the electrical conduction of the heart, causing it to beat. More calcium entering the heart equals a stronger heartbeat. When too much calcium enters the heart, it starts to beat too hard. You can see here the electrical signal shooting rapidly. This is stimulated by too much calcium entering the heart, causing a harder heartbeat. The harder the heartbeat, the more blood it pushes out, which increases blood pressure. The heart is beating too fast due to the binding of norepinephrine and epinephrine to the beta 1 receptors in the heart. This puts stress on the blood vessels and increases blood pressure. To stop the binding of norepinephrine and epinephrine, we can use beta blockers. Let's see how they work. Beta blockers bind to the beta 1 receptor. They stop norepinephrine and epinephrine from attaching to the beta 1 receptor. This decreases the available energy needed to open the calcium channels, so the calcium channels close. With decreased calcium entering the heart, conduction slows down to a regular pace. This reduces the strength of the heartbeat. With a softer heartbeat, blood is not pushed out with as much force, which reduces blood pressure. The beta receptors in the heart are mostly beta 1 receptors, but other beta receptors exist in the body, like beta 2 receptors. Beta blockers can be selective for beta 1 receptors or non-selective and work on both beta 1 and beta 2 receptors. With less calcium entering the heartbeat has normalized and blood pressure has decreased.
In my next slide, example of beta blockers, there is a metoprolol. Metoprolol is a beta blocker used in the treatment of hypertension and angina. Angina is an heart disease and used to reduce mortality due to myocardial infarction. Brand name of metoprolol is low pressure and their generic name is metoprolol. Structure. Metoprolol is a propanol amine that is 1 propan 2-ol substituted by a 4,2-methoxyethyl phenoxy group at position. It has a role as a adder beta adrenergic antagonist and antihypertensive agent as a xenobiotic and environmental contaminant and a geroprotectors. It is a propanol amine, an aromatic, either a secondary alcohol and a secondary amino group. This is the structure of beta blockers, that is metoprolol. The next slide, mechanism of action of metoprolol. Metoprolol is a beta 1 adrenergic receptor inhibitor specific to cardiac cell with negligible effect on beta 2 receptor. This inhibition decreases cardiac output by producing negative chronotropic and inotropic effect without presenting activity toward membrane stabilization nor intrinsic and intrinsic sympathomimetics. Certain certain and ACE inhibitor is also used for the treatment of heart because our heart and our kidney is related to each other. In the next slide, ARBs. ARBs are the angiotensin receptor blockers, are known as the angiotensin 2 receptor antagonist, are used to treat high blood pressure and heart failure. They are also used for the chronic kidney disease and prescribed following a heart attack. They include irbesartan, valsartan, losartan, and if the name of medicine end in certain, it is ARB. Their suffix is certain. Working of ARBs. ARBs work by blocking receptor that the hormones act on, specifically AT1 receptor, which are found in the heart, blood vessels, and kidneys, blocking the action of angiotensin to help to lower blood pressure and prevent damage to the heart and kidneys.
Hey guys, in this video we will see angiotensin receptor blockers, in short ARBs. It is a group of drugs that inhibit renin-angiotensin-aldosterone system. We will study the topic under these headings. So let's start with some basic points first. In video of renin-angiotensin-aldosterone system, we have seen that angiotensin 1 is converted by angiotensin converting enzyme, also called ACE in short, into angiotensin 2. A point that I want to add here is, apart from ACE, there are also other pathways through which angiotensin 2 is synthesized. Now, there are two subtypes of angiotensin receptors, AT1 and AT2. AT1 is responsible for most of the effects of angiotensin 2 that we know, like increase in blood pressure, constriction of efferent arteriole in kidney, etc. Function of AT2 is not clearly understood yet. Now let's go back to ACE. Apart from synthesis of angiotensin 2, it is also involved in degradation of bradykinin and angiotensin 1,7. So this was some basic of renin-angiotensin-aldosterone system. Coming to the drugs that inhibit this system. One group is ACE inhibitors. They inhibit ACE and thereby reduce synthesis of angiotensin 2. The second group and topic of this video is angiotensin receptor blockers. They bind with angiotensin receptors and block the effect of angiotensin 2. They are 10,000 times more selective for 81 receptors. Its overall effect of ACE inhibitors and ARBs is same, that is, decreasing the effect of angiotensin II. Both the groups share some common features, like some common uses and side effects. That said, there are some differences. A clinically important difference is, with ACE inhibitors, bradykinin degradation is blocked. So bradykinin level increases, which cause side effects like cough and angioedema. However, with ARBs, bradykinin degradation is intact. So cough and angioedema are less frequent with ARBs. Similarly, angiotensin 1,7 level also increases with ACE inhibitors but not with ARBs. The next difference is ARBs produce more complete inhibition of angiotensin II activity. That is because ACE inhibitors inhibit only ACE. So there will be some angiotensin II synthesized by alternate pathways. This will act on angiotensin receptors and produce some effects. ARBs act directly on receptors, so effect of all the angiotensin II is blocked. Next difference is, with ARBs, more angiotensin II is synthesized as feedback. As 81 receptor is already blocked, this angiotensin II now acts on 82 receptors. So these were some differences between these two groups. Drugs in ARBs are candesartan, aprosartan, losartan, olmesartan, telmisartan, valsartan, irbesartan, and azilsartan. Talking about pharmacokinetic, they are mostly given orally and elimination occurs by hepatic and renal route. Coming to the uses and side effects. As I said earlier, clinical utility and side effects of ARBs are similar to ACE inhibitors. We have already studied them in detail in video of ACE inhibitors. Most of those concepts are applicable to ARBs also. So let's go through the uses and side effects of ARBs quickly without repeating the detail. They are used in hypertension, heart failure, post-MI patients, and in diabetic nephropathy. Side effects are hypotension, especially in patients with high plasma renin activity, hyperkalemia in patients with renal disease and those taking potassium-sparing diuretics, renal failure in patients with renal artery stenosis, and teratogenicity. So this was all about ARBs. Time for summary. ARBs include candesartan, aprosartan, losartan, olmesartan, telmisartan, valsartan, irbesartan, and azilsartan. They block 81 receptors. Their therapeutic profile is similar to ACE inhibitors. They are used in hypertension, heart failure, post-MI patients, and in diabetic nephropathy. Side effects are hypotension, hyperkalemia, renal failure in patients with renal artery stenosis.
In my next slide, the low certain. This is a ARB, low certain. Certain is suffix for ARBs. Low certain, sold under the brand name Kuzor, among other, is a medication used to treat high blood pressure. It is also used for diabetic kidney diseases, heart failure, and left ventricular enlargement. It is taken by mouth. It may be used alone or in addition to other blood pressure medication. You can use low certain with other medicine that is used for the curation of your blood pressure. Mechanism of action of losartan. Losartan and its principal active metabolite block the vasoconstrictor and aldosterone secreting effect of angiotensin II by selectively blocking the binding of angiotensin II to the 81 receptor found in many tissues like vascular, smooth muscles, adrenal gland. And the generic name of losartan is the losartan potassium, and it belongs to the drug class ARBs, angiotensin con- about pharmaceutical industries in Pakistan because my topic is about medicine of heart and kidney. So that's why I'm discussing about the pharmaceutical industry. The pharmaceutical industry in Pakistan has grown during the past recent decades. At the time of the independence of Pakistan in 1947, there were few production units in the country. Currently, Pakistan has more than 800 large volume pharmaceutical formulation units, including those operated by 25 multinational present in the country. 25 multinational pharmaceutical are present in our country. Almost all the raw material used in making of medicines are sourced from abroad. Means the medicines raw material are also be import from the abroad. About 50% of them are imported from India. So now we can import raw material from India. Pakistan pharmaceutical industry meet around 90% of the country demands of finished dosage form and 4% of active ingredients. Specialized finished dosage forms such as soft gelatin capsule, parent, uh, parenteral fat emulsions, and metered dose inhalers continue to be imported. These are only a few bulk drug active ingredients producer, and Pakistan mainly depend on import of bulk drug from its formulation need, resulting in frequent drug shortage. Political disturbance and allegations of under invoicing add to the uncertainty of import, and clashes with the custom and tax authorities are common. The national pharma industry has shown growth over the year. Particularly over the last decades, the industry is trying to upgrade itself, and today the majority industry is following local good manufacturing practices law, with a few in accordance with international guidance. Currently, the industry has the capacity to manufacture a variety of traditional products ranging from simple pills to capsule, ointment, and syrup. In 2017, World Health Organization accredited the first Pakistan drug formulated by Gates Pharma. Gates Pharma is the pharmaceutical company that is situated in Pakistan that can be accredited by World Health Organization for the very first time. In my next slide, I'm giving the names of some companies and pharmaceutical that are present in Pakistan. Multinational companies means GlaxoSmithKline Pakistan, Matindo, Hilton Pharma Limited, Cereal Companies Limited, Abbott Laboratories, the Pharma Evo Private Limited, Karachi. The Pharma Evo company is that company that produce the medicine of heart. What is pharmaceutical manufacturing? It is the process of industrial scales, synthesis of pharmaceutical drug by pharmaceutical companies. The process can be broken into a series of unit operation that are one is the milling, second is the drying, third is the compression, and fourth is the coating. This is the unit operation for the manufacturing of medicine. In this diagram, the stages of pharmaceutical manufacturing is described. I'm describing it one by one. Now I'm moving my cursor to explain this diagram one by one. The first, my cursor is on a starting material. The starting material is a chemical. Chemicals, that is the raw material. After raw material, API. API is the active pharmaceutical ingredients. These are the active pharmaceutical ingredients. And excipient, these are the inactive substances that mix to form a medicine. The finished product is going for packaging. First is the primary packaging. After primary packaging, the secondary packaging occurs. In next slide, regulatory approvals. Regulatory approvals, all import are subjected to no objection certificate from DRAP. DRAP is the Drug Regulatory Authority of Pakistan, which means that every material import in Pakistan require attestation from ADC DRAP as per local law. According to law, these material are imported in Pakistan require an attestation that pass by a DRAP. The government has granted various relief to pharmaceutical sector on import of raw materials. For example, reduction in custom duties under the fifth schedule of the Custom Act 1969 and exemption from GST under the sixth schedule of the Sale Tax Act 1990. Drug testing system in Pakistan. DRAP is the Drug Regulatory Authority of Pakistan, established in 2012, enacted under DRAP Act 2012. The authority is mandated for effective coordination and enforcement of the Drug Act 1976 to regulate the manufacture, import, export, storage, distribution, and sales of therapeutic goods in the country. Production. The Pakistan pharmaceutical industry meet around 90% of the country demands of finished dosage form and 4% of active ingredients. Here are some applications. The spectrophotometry pharmaceutical application. The pharmaceutical analysis is mainly focused in drug analysis, in raw material and pharmaceutical formulation involving the determination of active components, impurities, excipients, content, uniformity, solubility, dissolution rate, and stability. So spectrometry, we can measure the medicine impurity, their content, and their solubility, etc. Direct analysis. Through spectrophotometry, direct analysis of target compound are only possible if the wavelength used is not interfered with by other species. Analysis of mixture of component is possible by means of derivative spectrophotometry or chemical derivatives obtained by reaction like redox, ion pairing, metal ion gelation, azodide derivation, if base formation.